We are live tonight. It is September 11th, and the number is 252. Oh, I don't have a phone. I'll get a phone. 252-407-1111 if you all have a question. It'll have to be pertinent to menopause tonight, but if you're suffering from something and you want to ask Dr. Dauber, what do I do? Help me. She'll be happy to help you talk through that. So we'll go ahead and do that. We'll get the phone in just a few minutes. So we're going to just head out right away. Carol's going to tell us about the Drinking Gourd Gallery. They've got a big exhibit coming here, and we're excited about that. So she and Dr. Dauber are going to kind of partner up and talk about this event that's coming. It sounds pretty interesting. I think I'm going to put it on my calendar. So welcome, Carol. Welcome, Dr. Dauber. So glad to have you all with us.
Thank you.
So Carol, we'll start with you. Tell us about this.
Sure. Absolutely. Well, thank you so much for having us. As you said, I'm the owner of Drinking Gourd Gallery, and in October we're going to be presenting an art exhibition called M is for Menopause, and along with that we'll also have some associated programming. And M is for Menopause is a group exhibition that's dedicated to exploring the menopausal journey, trying to break the silence about it and also challenge some of those stigmas. And so October the 3rd, we're going to have an opening reception. October the 12th, we'll have our Women's Wellness Day, which is an event that Dr. Dauber and I are partnering on.
Where's this reception at?
So everything is at Rocky Mount Mills.
Oh, okay.
Over at the Mills. And they've been a wonderful partner. This is our second year of doing this, so we're very excited. So on October the 12th, as I was saying, it's a day-long event, a Women's Wellness Day. And we'll start off with talks, hearing from medical professionals led by Dr. Dauber. And also we will be having a lot of other workshops around writing and painting. And we'll end the day with a conversation circle about menopause and also a sound bath, which is where you're immersed in sound. So we hope to have a very relaxing day. So it's really about self-care. We hope people will come out. This is a ticketed event, and the tickets are available on the Drinking Gourd Gallery website.
Okay.
And
is there a fee for the tickets?
Yes, the fees are $12.
Okay. All right.
And then
that's certainly not expensive.
Yeah, we get a lot for that.
And part of the proceeds are actually going to a local charity, the Lighthouse Home, which helps women during times of transition. So.
Oh, okay. Awesome. That's great.
Yep. Then continuing with our programming, on October the 18th, we're having a comedy show over at Hop Fly.
We all need to laugh, don't we?
Yes, absolutely, particularly when you're going through menopause.
Yes.
So we're looking forward to that. And then on October the 19th, we'll be over at Pinspiration with information and also hanging out with them and enjoying some classes, and we invite people to come to those. And then we'll end up on October the 27th with a virtual book discussion. So even if you couldn't come to all of the in-person events, there's still an opportunity to be a part of the event. And we're excited to have some great sponsors. We, of course, have Rocky Mount Mills, which is our space sponsor, and UNC Health Nash,
of course,
Dr. Dauber, and also Box House Rocky Mount, Hop Fly, Kiki Piper, Pinspiration, Miss Barbara's Music, and also Spectrum Counseling.
Awesome. That's great.
Awesome.
I remember, I didn't go last year, but I remember seeing it maybe on Facebook or someplace. I don't remember. I saw the advertisement and I went, oh, I think it's so important because I don't think we talk enough about menopause, and we don't talk enough about what happens to our bodies and what happens to our brains and what happens to everything that's part of us with menopause. So I think this is just awesome that and this is your second year, which tells me it was
second year.
Must have been a success last year. So
absolutely,
that's
great. And it was inspired by my own personal experience with menopause. I was completely clueless. I didn't know what was going on.
Right.
I just knew that my skin was dry, my periods were heavier, I had mood swings, hot flashes, all of those things, and I didn't know what was happening.
Right.
So if there's some way that I can help other women who are trying to navigate this journey through something like this, I want to do it.
I think that's great, and that I think we walk down roads during our life, and then we say, okay, we're going to have to, focus on this one. This is a big
Right.
one.
Absolutely.
I remember when my kids were little, I'd just go, what? They didn't come with the manual. I don't know what to do. That mother's instinct doesn't always kick in for everything you need, and at least it didn't for me. So anyway, this is really awesome. Dr. Dauber, you have any additional input?
Yeah, so I think the Women's Wellness Day is going to be a great experience. So we're going to have a variety of healthcare professionals and sort of lifestyle professionals who are going to be present at that day, including dermatology. We have a personal trainer who's going to speak, myself, and then another women's health professional. And then we also have a mental health professional. So sort of kind of rounding out all the facets along with a pelvic floor physical therapist. And so sort of thinking of how women move through menopause and that sort of menopausal journey. So trying to answer as many questions as we can. They're going to be sort of like the TED style talks. We've got 20 minutes. So, hopefully we'll get through as much as we can. But it's going to be a good day. And then I love how Carol really partnered that sort of educational piece with more of sort of the spiritual and also sort of the expression that you can do through art and music and things like that.
I think it's great. It's just, she's a smart cookie.
She is.
Thank you.
I'm glad I found her.
Yes.
Yeah,
We found
I
each other.
think, it's really awesome that you two have the same interests and you partnered together and made this event. I mean, it's just mind-boggling to me. I have
wonderful.
about that much creativity in my body, so I'm not the creative type. So I'm always, like art history and art classes were my favorite college classes, and I love the museums and it just. And because I marvel at people's brains and how they can create that and how they can express themselves that way, because it's not my gifting.
Yeah. We're all creative. We're all creative.
We are? Oh, well, okay, I guess. I can talk to people and sit in front of a TV,
Exactly.
Yeah, that's absolutely
camera,
creativity.
so I guess
Absolutely.
that's creative, right?
Absolutely.
Okay, let's just go over the dates again, so people, if you want to mark
Sure.
this down on your calendars.
Absolutely. So October the 3rd is going to be the opening reception and artist talk. We have about 10 artists represented in the exhibition, and there'll be roughly 30 pieces of art on display. And October the 12th is the Women's Wellness Day, and October the 18th is our comedy show, and October the 19th is when we'll be over at Pinspiration for art and candle making classes, and then on October the 27th we'll have our virtual book discussion.
Awesome. There's so much, and so if you can't make the first one or two, there's still plenty
right.
of other things
There's a
to
lot to take
participate
care-
in.
take in.
What book are you going to be talking about?
So we're going to be talking about Grown Woman Talk by Dr. Sharon Malone, which my sister is actually a librarian, so she'll be heading up that discussion.
Oh, okay.
So I'm
Awesome.
looking forward to that.
So it's a family affair
It
as well.
is, it is.
That's great. All right. All right, so we're going to take our first break a little early tonight, and then we're going to get right into perimenopause, menopause, what it does, what you can do to help yourselves, and we'll go into all of that. So hang on and don't go away, and we'll be right back.
Nash, you can get both. Take advantage of great benefits, including signing bonuses up to $25,000, student loan forgiveness, and much more. Plus, gain valuable frontline experience in an organization that prioritizes nurses' feedback. Apply today at nashnursing.com and discover how you can get big city benefits at this small town hospital.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mount area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
Are you tired of disappointing your partner? Do you feel less than adequate? Primary Care Urgent Care of Nashville is introducing a revolutionary treatment for sexual dysfunction. you can restore the pleasure between you and your partner with a non-invasive and effective treatment with lasting results. This procedure is a quick 15-minute in-office treatment with no topical anesthetic and no recovery time. Call 252-676-6792 for a consultation about this revolutionary non-invasive treatment today. Primary Care of Nashville is now accepting new patients.
Hey, welcome back. This is Here's to Your Good Health. We're doing things a little different tonight, but that's okay. It's good to change up, isn't it? It keeps us on our toes. Anyway, I got my phone, so if anybody's interested in calling, it's 252-407-1111. This is Here's to Your Good Health, and tonight I have with me Dr. Joanna Dauber from UNC Nash, and she is a menopause specialist, and so we are going to be talking about menopause, and anybody who watches this show knows I talk a lot about this subject, so this is not for you fellas. You can go and, I don't know, go outside and paint or mow the lawn or something. Or you can listen, of course. It's always good to know, but this is really focused on women's health tonight. So, Dr. Dauber, again, welcome. So
you.
excited to have you here.
Thank you.
So I think I wanted to start with perimenopause, if you don't mind. We
Yeah.
can focus on that a little bit.
Sure. So just sort of taking a little overview of how I got interested in
Yes, of
menopause
course.
and sort of what I am a family medicine physician. I practice at Rocky Mount in Eastern North Carolina Medical Group. I am an osteopathic family medicine trained physician, so I also practice osteopathic medicine. But during residency, I became really interested in menopause. I was always interested in women's health, but it seemed that there was a point where we really focused on the childbearing years, and everything was centered around, contraceptive counseling and things. And it seemed like no one really knew what to counsel or tell women, right, when they entered sort of that perimenopause or menopausal time of their life. And so, kind of to your question, what is perimenopause? Perimenopause is sort of the period around menopause, right? And that can vary and start at different ages, right? So some women might start experiencing symptoms in their late 30s, right? Some might have those symptoms start in their 40s, right? And it's sort of the changes that accompany the changing estrogen and the changing hormone levels. And so I will have, women will come to me and tell me about just various symptoms that they're experiencing that maybe another provider or someone else just said, oh, that's nothing, you'll get over it. But really, when you look collectively, it's a really time of people's life that people undergo immense changes, right? And whether that's physically, emotionally, mentally, and sort of how you navigate those various sort of feelings, right? And how you navigate the experience of going through that. And so when I talk to women about perimenopause, I say, you might see something and your friend might have the same thing, or you might have two totally different symptoms, right? So the most common things that I see early on are not the hot flashes or things like that that people experience, but often sort of changes in mood, right? So it might be that women feel more anxious, right? Or it might be that they experience sort of more sadness, right? And sometimes those are the earlier signs that I see for women undergoing that, or hair and skin changes, weight changes, things like that.
Awesome. And so I've noticed in my practice that women are starting to talk to me sooner about these things. You kind of, the general focus was menopause hits around age 50, but and then maybe the 40s up to 50 is the perimenopause, but I'm seeing that in some younger women now. So.
Yeah, I think the conversation has opened up, really. I
Maybe
think
that's what it is.
I think that for a long time, menopause was associated with this this aging, and it was seen as sort of this bad period in our life when all of these things happen. But I think that we as a society have really moved forward and are embracing how do we age, how do we, do the things that we still love to do in our 20s, 30s, 40s, and 50s, and how do we just do that in sort of a body that is adapting to a new set of hormones and things like that.
Yeah, yeah. And it's good that this is coming out. It's good that we're talking about it, because I don't know, when it comes to any form of sexuality, and this is really not sexuality, it's really more physiologic changes in our body due to our aging, but it's so taboo, and we need to be able to open up and say, all right, now, you're okay.
Yeah.
This is what's happening.
100%.
You're not some freak. You're not going crazy, because people think that.
I think that for a long time, women were kind of gaslit in many ways and told that they were, crazy or this sort of thing in different ways. And I think we've moved that conversation away from that and sort of understanding better as a society about those changes. And I think even if you look at the last, few years, right, menopause has come up far more often in, sort of the media, the popularity of discussing menopause and menopause providers. I have attended the Menopause Society conference several times, and really this is the first year that it's really sort of taken off, and it's sold out. And so I think the conversation around menopause has really shifted from something negative to something that it's just another part of life.
Right. And I think, I can't think of any stars off the top of my head, but as they transition through all of this,
Jennifer Aniston, Halle Berry, all of
so
those,
they're so that just helps.
Yeah, absolutely.
There's a lot of that kind of lifestyle I'm kind of leery about, but it really does help open up the conversation.
Yeah, absolutely.
Yeah. So how long does perimenopause last?
It depends, right? So I think each woman's journey is different, right? And so it's sort of that time around menopause until you really experience that last period. And so when I talk to women, it can last a couple of years, right? It might last 10 years. We also know that there are differences in different demographics, right, in terms of symptoms. So for example, African American women often experience symptoms like hot flashes and things like that for a longer duration than their Caucasian counterparts. And so I think that sometimes that's often overlooked, and we think, oh, no, you should have been done with that by now, but that's not true, right? And so I think each person's experience is really different. And so when I look and sort of talk with the women that come to me, I really try to tailor that experience to what their journey is.
Yeah. And I know people say, well, I'm through menopause. Well, no, you're in menopause the rest of your life. I mean, you don't have all those symptoms, but that's kind of how we define it. So, I've had patients that one lady, she was so grateful to talk to a female that had been through menopause, which is me, because she had gone to her gynecologist, and he said, well, and at one point they were just giving you all antidepressants. Well, we're not depressed. We just are going through stuff we don't know what we're going through. So it's it's come a long way.
It has 100%.
Yeah.
I think so.
So what do women have to look forward to? Let's talk about the weight gain. Everybody wants to know about the weight gain. Everybody wants to go because they've got all this belly fat.
So I think it's different for every woman, right? I think that definitely the changing metabolic factors that happen during sort of the perimenopause and menopausal time sort of change that sort of overall body composition, right? So we move from having a lot more muscle tissue, right, to having more adipose tissue. And we also have a redistribution of that tissue in different places. A lot of times in places we might not want it. When I counsel women about, weight management, right? I try not to use weight loss, right, as that topic, because I really want people to feel comfortable in their bodies, but also be at a health level for themselves, right? Working to try to expand their overall health span, not just their lifespan, is my job. And so one of the things that we do together is we look at the overall picture of what plays into weight management, right? And so that might be things like sleep, right? Stress levels. We talk a lot about foods that nourish our bodies, right? So food is a fuel for us. And so we really want to pick the foods that are fueling us throughout the day. I'll do food journals with my patients and sort of look through and try to give the best advice that I can. And then we also talk about ways to help with sort of that, redistribution of muscle mass, right, and sort of the changing composition, right? So trying to get that physical activity in that's recommended, trying to get the weight training that's recommended. And then there is a role, and I think a place for weight management medications for some patients, because it is really defeating for, I think, a lot of patients who are doing all of the things that we as medical providers have told them for so long, but they don't see that change, right? And that can be really defeating. And so I try to take and look at that whole picture and then make a plan for each person.
That's awesome. So do you recommend like a higher intake of protein in the diets, or what kind of, let's talk about the diet a little bit.
So in terms of cardiovascular health, because that's what I start really thinking about during, perimenopause and menopause, is that time period in the lives of women is one of the most important in order to get the things that their body needs and also prevent long-term cardiovascular disease. The Mediterranean diet, right? So lean proteins, fish, lots of vegetables, fiber, whole grains is something that I recommend, and that's important. I would say that protein content is important to have in the diet, and whether that is meat-based, right, or plant-based. Especially with the newer data coming out about plant-based diets and how they benefit cardiovascular health. I haven't convinced too many people to become vegetarians, but I think that's something that I do try to emphasize. You can make food that does taste good and is healthy. And the one thing I will say is I try to steer people away from some of the more fad diets, right? Like food is, again, a way to fuel yourself. And so, eating all meat diets or all this, or, I think trying to figure out something that's sustainable, which is what's really important too. Right.
Yeah, I think, I'm big on healthy eating, and I'm big on fresh. I don't like processed. I don't go through a drive-through except every once in a while. I have to have a French fry. I have to go to Freddy's. They've got great French fries.
I've never had those. I'm sure they do. But no, I agree with you. We've learned a lot about how processed foods have really affect, not only our health, our gut microbiome, all of those things. And so I tell my patients that I really want them to try to shop on the outside perimeter. If they can get something fresh, that's great. But I also understand a lot of those things can be costly. And so there are ways to get healthy foods without buying just the fresh. Frozen vegetables, frozen fruit, things like that. Just watching that sort of extra sugar added or anything like that.
Right. So, it's really important. And, of course, I'm a big farmer's market girl.
Yeah, love the farmer's market.
Me too.
Every
I go about every week. So, I'm grateful for that farmer's market. I think they do a great job. So, what are the recommendations for exercise at this point? Still the same?
So, I try to get people both moving and doing exercise, right? So when I talk to people about moving, it's that sort of, making sure you're walking, making sure you're, up out of your chair at least once every hour, because we as a society are so sedentary, right? We sit at our computers, we sit at home, watch TV, so trying to get people up and moving. So that's my first part. And then I really do encourage sort of the recommendations by the American Heart Association, which is trying to get at least 150 minutes of that moderate activity. And then talking to people about weight training, right? So that's also a really important component for women in the perimenopausal and menopausal state. And so, building that lean muscle mass through making either resistance training or weight training is something that I encourage my patients to do.
Right, yeah,
So.
it's really important to do all that.
And starting small, right? So
yeah.
I joke with all my patients, I don't expect you to go out and, start pumping iron like Arnold Schwarzenegger or anything, right? So I want you to start small and do things that you can maintain and continue on a regular basis, because that's important. Consistency is important.
Yeah.
Sustainability is
Yeah.
important, so.
Yeah, and it is important to start small. I tell my patients, well, you drink 4 sodas a day. How about we drink 3 a day and add
Drink
water?
some water, yeah, absolutely.
And try to, replace the soda with the water. The thing, people don't understand what soda does to you.
Yeah, I think it's about habit forming, right? So there's a great book, Atomic Habits, about how people make healthy, or how people create habits, right? And we all get into habits and routines of, I get up, I brush my teeth, I do certain things. And so it's those little changes and habits that you can do every day to make a long-term sustainable health plan for yourself. So if it's, I used to drink 4 sodas a day and now I drink 3, that's great, right? That's a win for you.
Absolutely.
And it's good to celebrate those things.
Yeah.
But also remember that there's still always work in progress to do.
Yeah, you've got to be able to attain goals.
Yeah,
you
absolutely.
You can't say, I'm going to lose 50 pounds. Well, let's start with 5.
Yeah.
And when you get that
Small
goal,
goals.
yeah,
Yeah.
they're more attainable and they pump you up, I think.
Yeah, you got to have some wins.
Absolutely.
Absolutely.
So is there anything women need to be doing differently than, because we're in menopause now, do we have to act differently or dress differently?
No,
or-
absolutely not. No. I think that, well, one, dressing is a self-expression of yourself,
Right,
and you can wear
right.
whatever you like
That's
to wear.
right.
And I think that women should just really find and be them true selves. Right? I think that whatever stage in life you're in, right? I think that you should express yourself in whatever way you feel comfortable.
Right. So let's start talking about some of the symptoms of menopause. So, I know there's the weight gain. We've already kind of addressed that. So hot flashes, I guess, is probably the most uncomfortable probably symptom you have with menopause. At least it was for me.
Yeah, and so for everyone, it's a little different. And hot flashes are probably the topic that most women bring up, right, in the office. And so hot flashes is that sort of sudden heat sensation, that sort of burning internally that women describe. And it can be accompanied with flushing and sweating. It can happen in the day, it can happen at night. You can have 1 a week, or you could have 100 a week. And sort of, the hot flashes can be really bothersome, right? Especially if they're happening for women at work, right, or at school or at church. And it's great that we have come a long way in the management of hot flashes. So there's a lot of things that women can do other than just dress in layers, right? Because that's not really helpful.
Carry a fan around.
Carry a fan around, yeah. That just fan yourself lightly. Drink water, right? But there are newer medications on the market that women can use for hot flashes, and then there is overall systemic treatment, right, for like hormone replacement therapy. So I try to counsel women about hot flashes, knowing some of their triggers, right? And it might be stress. Alcohol can be a bigger trigger for hot flashes, smoking. So I try to counsel all my patients to quit smoking for a variety of reasons, right? Hot flash management is one of them. But thinking about what are other ways that we can treat those hot flashes for them.
Right. So are there any supplements out that women can take when they first start having hot flashes? I know there's black cohosh. I don't know if it works or not.
Yeah, the data is really mixed on a lot of the supplements. So, I follow closely the Menopause Society guidelines on sort of supplements for hot flashes. And sort of some things work for some women, some things don't work for some women.
Right.
So I usually try to steer women towards the most effective therapy. And usually that's something that's prescribed often, either hormone replacement therapy or some of the other newer medications on the market.
So there is a new one out, starts with a V. I don't remember.
Veoza.
Veoza for hot flashes. Have you had any experience with that? Is it working for your patients?
Yeah, it's actually a really great medication because it doesn't affect, so I'll take a step back. Hormone replacement therapy is a great and safe, effective therapy for women for a lot of things, but it also does carry some minimal risks. And so for a certain population of patients, those risks are something that I'm not willing to take, right? So if someone has a history of a heart attack or a stroke or something like that, it's a little more nuanced of a conversation. But Veoza is great and really has helped, many women that I've seen with their hot flashes. I think the biggest issue with any of the newer medications is always coverage, right, for
Yes,
prescriptions.
yes,
But
yes.
yeah, I think it's a great medication. So
Okay. At one point, several years ago, they were giving low dose, is it sertraline? Paxil, yeah. Is that still being used? Has that been effective?
I think it is effective and sometimes can help with sort of some of the mood changes that women might often see. I think the thing with Paxil is it's often a medication that's harder to stop because of some of the taper down side effects that women can have. And so I try to go with sort of the first line therapies first, which is usually like Veoza or hormone replacement if that's deemed necessary. And then if not, then we'll kind of move down the line. Gabapentin can also be used for hot
really?
flashes. Clonidine is used, probably one of the less effective medications, but we try to do some of those.
Well, how is the insurance coverage for Veoza? Is it pretty good or not really or sort of? Or
It depends. Insurance
I know,
is insurance
I
nowadays.
know,
That's a
right,
loaded
right.
question. So, I think that for commercial insurance, it's often covered. They also have a copay card
Yeah.
that some women will use.
Okay,
So
okay.
I try to work with women and try to make sure that I'm not prescribing something that's not attainable for them because that's kind of a really cruel thing to do. Like, I have
know.
this treatment for you, but
But
you can't have
afford
it.
it.
Yeah.
Yeah.
So hopefully with the increasing conversations about menopause and more women stepping up to say, hey, this is an important medication to me, hopefully more insurance providers will work on getting coverage for it.
do you suppose that there's, I'm sure I already know the answer to this, that there's probably more companies working on similar drugs?
Oh, I'm sure.
Yeah.
Yeah, I'm sure. Even in sort of the hypoactive sexual dysfunction realm, right? So before, when women would have decreased libido, there wasn't really too much to give them, whereas men
Right.
could have Viagra, right?
Right.
Or Cialis. So now there are newer medications on the market for that. So I think that
Are there?
I think we've expanded the conversation about all of the symptoms that accompany sort of the perimenopause and menopausal phase. And so I think as more women step up and say, hey, this is important, we'll see more and more things.
Yeah.
I don't know, my Instagram feed is inundated with menopause, but maybe that's just because the algorithm, I'm not sure. Maybe they just figured me out. So.
There's that Dr. Dauber.
Yeah, she's always
All right,
looking.
we're going to take our next break, and when we come back, we'll be talking more about menopause and symptoms and what we can do and how we can live through it, and we can have a great life.
Nash, you can get both. Take advantage of great benefits, including signing bonuses up to $25,000, student loan forgiveness, and much more. Plus, gain valuable frontline experience in an organization that prioritizes nurses' feedback. Apply today at nashnursing.com and discover how you can get big city benefits at this small town hospital.
We're in our 18th year of practice at the Hammer Chiropractic Center, and we've seen over 15,000 different people in the Rocky Mountain area. 40% of headaches actually come from a neck problem. Many patients come in taking multiple aspirin, over-the-counter medications and such a day, and we can get you to stop doing that and actually fix the problem so the headaches don't arise anymore. A lot of people think chiropractic hurts. It does not. Most of the people come in and they feel great when they leave.
Are you tired of disappointing your partner? Do you feel less than adequate? Primary Care Urgent Care of Nashville is introducing a revolutionary treatment for sexual dysfunction. You can restore the pleasure between you and your partner with a non-invasive and effective treatment with lasting results. This procedure is a quick 15-minute in-office treatment with no topical anesthetic and no recovery time. Call 252-676-6792 for a consultation about this revolutionary non-invasive treatment today. Primary Care of Nashville is now accepting new patients.
Welcome back. This is Here's to Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical, and we've got Dr. Joanna Dauber with us tonight, and we've been talking about menopause, and it's a fascinating conversation for me because I treat lots of women with it and I hear lots of questions, and so I think I've told you multiple times I always learn something on this show, and I'm learning a lot tonight, so I appreciate that, Dr. Dauber.
Awesome.
Thank you. So we're going to move on. We're going to talk about the mental health aspect of menopause for women. So tell me about that.
Yeah. So, during sort of the perimenopause and menopause time, women are more often to be diagnosed with anxiety, depression, and these are things that, I think really are not talked about enough, right? And so I encourage women when they are feeling, something different, right? Maybe it's just something's a little off, or a little more irritable, or a little more anxious, or just not feeling how we used to talk with their healthcare professional, because there are ways to help combat those things, either through counseling, right, peer support, right, and sometimes medications are needed. But I think it's really important for women to seek help and not silently suffer. I feel like as they have for so long.
Yeah. And you address this with your women when they come in to see you?
I do. So, there are validated screening tools for, anxiety and depression. And so those are part of my Well Woman visits, or part of, just in general practice visits. And so I try to understand, really, is this sort of a situational thing, right? It's, if something happened, or, more stress at work, or is this something that you've, been ongoing with more than, 2 to 3 weeks, right? Because that can be a red flag, an indicator that maybe there is something that's off and that we need to address it before it's too late. So
yeah, awesome. And then we've been talking about younger women, and they can go in menopause, and especially like surgical menopause. So what exactly is that?
Yeah. So, one of the questions I've been asked before is that, if I've had just a hysterectomy, do I go through menopause? And that's an interesting question. Really thinking about the loss of estrogen if someone has, a total hysterectomy and removal of their ovaries. So, I have several young women in my practice who underwent that procedure for various reasons. And then, needed that sort of hormone replacement at a younger age because they started having all of those symptoms. And so I think that's always something that if that's happened to you, or you've had, that surgery, to talk with your provider about getting treatment. Because, going through menopause at 30 is a tough thing. It's tough at any age, right? But I think that there are definitely conversations that should be had around that.
So leaving the ovaries helps, does it?
It does, though I don't do surgery, right, because I'm family medicine. So if someone had a hysterectomy and they left the ovaries, if they were able to, right, you always want to leave whatever is safe, right?
Sure.
And there wasn't a reason to take those. That can help prevent, obviously, someone going under early menopause, right? Because that estrogen source from the ovaries remains until it, naturally is over.
Right. So let's talk a little bit about hormone replacement therapy. Exactly what is that? What does that mean? How do you do that?
Yeah. So, all of our periods and all of our sort of female characteristics are driven by hormones, right? And most of those are estrogen and progestin, right? And so when we start going through menopause, we start losing that sort of estrogen that's produced by the ovaries. And we have different, there are a lot of different hormones involved. I won't bore everyone. But we try to sort of understand where someone is sometimes by, checking various levels sometimes. Clear Blue just came out with a stick you pee on, and it tells you if you're in menopause or not. I don't think it's that reliable, but they have a symptom tracker that also helps guide.
Okay.
But the sort of defining thing about all of the perimenopause and menopausal state is that sort of loss of estrogen. And so when women come to me to talk about treatment, right, whether it's for hot flashes, vaginal dryness, skin changes, different things like that, we talk about whether we want to treat the symptoms of certain things, right? Do we try this medication or this treatment for that, or do we think about doing some sort of systemic treatment with like a hormone replacement therapy? I think a lot of women were kind of scared about hormone replacement therapy after a report came out, several years ago, the World Health Initiative study, and sort of thinking about what complications can arise from hormone replacement therapy. And there was a lot of discussion about breast cancer. There was a lot of discussion about cardiovascular disease. And I tell women that, hormone replacement therapy is safe and effective for women. There are always risks and benefits to anything that we take, Tylenol, ibuprofen, whatever. Yeah, and so having that risk-benefit discussion and talking about those things and how it can benefit them, but also things to watch out for. And so when I prescribe hormone replacement therapy, I start thinking about, does a woman need both, an estrogen and a progestin, right? If she has an intact uterus, meaning that she has not had a hysterectomy, she needs both of those things, right? Because you need to protect the lining of the uterus. And so I typically, utilize either patches, pills, different things like that to provide them with what their preferred route of administration is.
And so there isn't one that's more effective than the other. It's just more patient preference.
It's patient preference, I think, is a big thing, and then always doing the lowest effective dose.
Of course.
Right. So I think that's something I'm asked a lot. Well, can't we just jump to the higher dose because it'd be more effective? But you always want to start with the lowest effective and titrate up. I think that there has definitely been movement in the market to make things easier for women. So there are several companies that have combined medication. So it's a 1 pill a day that women can take if they need it, both an estrogen and a progestin. So I think that's helpful. But I really try to listen and hear the preferences that they have and sort of base it off of their lifestyle as well. Right. For some women, a patch is not great if they run 10 miles a day and they sweat it off, right?
Yeah.
So.
Okay. So, is this hormone replacement, is it expensive?
Again, it sort of depends, right, on insurance coverage. Yeah. So, I work with women to try to find routes that they can afford, right? Because, if we are doing hormone replacement therapy, it's not for 1 week or 2 weeks or 3 weeks, right? It can be for months to years, depending on patient preference. And so we do try to work to find, but most insurance companies do cover some form of hormone replacement therapy. It's just how you tailor it together.
Awesome. So do women in menopause still have to have pap smears, or are they done then, or does that finish as you go into menopause?
That's a great question. So regular routine cancer screenings, whether it's your yearly mammogram, right, up until at least age 75, starting at age 40, and or cervical cancer screening until at least age 65 is really important. So when you go through menopause, you should still be seeing your healthcare provider and getting those regular cancer screenings. I think that I find a lot of women who said, oh, my period's over, I don't need to deal with that part of my body anymore. But it is important because there are other types of cancer as well, and there are other things that can happen not just with your period, right? So vulvar cancer, things like that. So.
Right. Yeah, it's really important, and I quit papping women at 65. Unless some women want to continue, and that's fine. That's up to them. Some, and I tease, but I'm serious at the same time. Well, if you're going out with several different men and you're in that phase of your life again, then you definitely need to be screened.
Yeah, I think that brings up a question of other types of screening, right? So sexually transmitted infection screening, right? Those are things that more people should be comfortable asking for, right? At all ages, right? And so I try to follow, the USPSTF guidelines in terms of cancer screenings. And so I counsel a lot of women about, when do we decide to stop screening? When should we reinitiate screening? Especially in women who have various risks, right? So all of those things can be very confusing. And so it's important to find someone who is sort of, up to date and in tune with those things. So,
Right. And then Sandra asked a good question. Can these symptoms come back?
Yeah. So there are definitely, menopause can ride like a wave, kind of, right? So you might have hot flashes, they might go away after a while, maybe they'll come back, right? I think it's important to always make sure and talk with your healthcare professional and make sure that, nothing else is going on as well.
Right.
But sometimes mood changes will come and go, hair and skin changes will come and go. The things that I see that remain pretty constant are sort of the weight changes that can happen, cardiovascular changes. So I often will see women's blood pressures just slowly start to increase, right? Somewhere in their 40s, and then by 50 or 60 they might need blood pressure medicine. Same thing with cholesterol. Those are things that change, that seem to always sort of trend in a direction. So I talk with women about how lipid profiles change, and those usually don't reverse themselves unless you're on a statin or become a vegetarian. So
Yeah.
one of those.
I push plants a lot, and you're right. People look at me like, what?
Yeah, plant taste good. They're good.
Yeah.
But I also do enjoy chicken, so I get it.
I'm a big fish person, so
okay.
I've got to have my fish.
Yeah.
I could eat fish about 4 times a week.
Oh, okay,
Yeah,
that's good.
Yeah,
I really good omega-3s.
Yeah, I can eat the Mediterranean diet without a problem.
Good, that's awesome.
My problem is I want all vegetables and I don't want enough protein. And I've got to force the protein.
Yeah.
So, but that's just me. So the symptoms can come back, and it's really it can, if you embrace this lifestyle and if you embrace the changes and just say, well, I think it can be good.
Yeah. It's just another time period of life, really. It's like, there's not a lot of discussion about, people go through puberty and they're not like, oh my gosh, the rest of my life I'm living after puberty, right? Like, it's just, again, it's just another time period of life, right? And so it's about how you move through it, right? And how you navigate, the various challenges at different points, right? So it can all be done gracefully.
Yes. That's not my middle name. Grace is not my middle name. I tend to fight things. No, I don't want those gray hairs. No, I don't want those wrinkles on my face.
And that goes back to that sort of negative connotation of aging that was so long, I think, in the media and in film and different things, right? And I think we've really moved beyond that. We look at women in their 50s and 60s, and we see that they're, just in a different period of their life, right? They're not portrayed all as, grandmas with gray hair, and gray hair's fine, right? It's a natural part of aging. It happens. Yeah, I have gray hair too. It's okay. I'm 37, so it's fine. So I think that having that conversation and feeling comfortable in our bodies, right, and sort of and being okay with things as they progress.
So do you think menopause maybe hits some people earlier, like depending upon how many children they have or anything like that? Do you think any of that has anything to do with it? Or?
Well, I think it's really individualized, right? So the biggest predictor, right, of what age you'll undergo menopause is really what age your mom went through menopause or your sister went through menopause, right? And so I think that has a lot to do with it. They've been trying to understand why maybe trends are in different ways. I haven't seen any really great studies who've shown one definitive thing over the other. Things that will age you, though, more, right? Smoking, right? Yes. Drinking more alcohol than recommended. Those are things that will definitely age you. And so if we're trying to not do those things and age our bodies, I kind of counsel against those.
Right. And that's just good health.
That's just good health.
That's just the way we're all supposed to eat and live. It doesn't matter what. So, All right, well, let's recap this. I'm really excited about
Yeah.
this M is for menopause.
Yeah, so we're doing this M is for Menopause event. It is a partnership with the Drinking Gourd Gallery out of Raleigh, and it's really this sort of collaborative, both art exhibition and educational event that we're having. It kicks off in early October, October 3rd actually, starting with sort of a reception and an artist talk, and then on the Women's Wellness Day, we are going to have a variety of different speakers, and then sort of some creative outlets for women to experience. And so, last year we held this event, and I'm so excited that it's back again, and we're really hoping that we can draw women from all over,
Yes.
not just Rocky
Yes.
Mount, but all
Right,
over North
right.
Carolina, and everyone, right? So this event is open to anyone who's interested in learning about menopause, not just women. So
It'd be good for men because they have to live with us.
yeah, it's good. It's good for everybody, and
Yeah.
I think that we often sort of only emphasize women, but there's another component to that, right? And
Yeah.
so
I'm going to take those flyers.
Yeah.
home.
Oh, you
I'm-
can- yeah.
I'm pretty excited
Yeah.
about it. I'm going to look at my calendar and make sure I can get to see some of that and
Yeah.
do some of that.
the art exhibit last year was amazing.
Was
I mean,
it?
there were some really beautiful works of art, and so I'm excited to see this year the creativity.
Is it going to be different artists or some of the same, or?
It's going to be different artists. So there's going to be a variety of art pieces. And really last year, you could just feel the emotion. So I'm
Really?
excited. Yeah, I'm excited to see
Oh,
what comes
that's
this year.
awesome.
And yeah.
I think I'm really amazed at how well it's put together and all the different aspects that
Yeah.
you've gone
That's
to.
Carol.
That's
Carol who was on earlier.
Okay.
She's-
Carol's
yeah.
on the couch. She
She's-
wouldn't sit with us for the last part of this.
She is really the mastermind behind this, and I cannot give her enough credit for all of that, the countless hours that she has devoted to this. But I think she saw a need, right, for
Right.
an outlet for women, and really has taken it to the next level. And so we're really excited to have this.
Yeah, it's awesome. Well, thank you so much for taking your time and coming tonight.
Thank you.
Informing my audience, informing me. I
Yeah.
always love to learn. I like to learn more. Looking really forward to that. Do you have anything you want to talk about before we take off?
I think just make sure you have someone who is providing your health care who listens. I think that's the biggest thing. So
Yeah.
I think so many women feel that they are not listened to. And I think it's important to have open and honest conversations
Yes.
with your provider. And I think if they're not willing to listen, I think finding care elsewhere.
Okay.
Yeah.
All right. Yeah, I'm really looking forward to that. I'm going to check my calendar.
Yeah,
and see
awesome.
When I can put it in.
It'll be great.
All right, well, that's it for us tonight. Thank you again so much for coming. It's
Absolutely.
been great.
Thank
you,
you.
Carol, sitting over there on the couch. And we will see you all next week with more of Here's to Your Good Health. Good night.